name is Dr. Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today we're going to talk about baby teeth. We call them baby teeth, we can call them primary teeth, we can call them deciduous teeth. The word deciduous is a Latin word that means to shed or fall off at a certain time in growth or development. So for children, deciduous teeth are the teeth that fall out as they get older and are replaced by the permanent teeth. So let's talk a little bit about the deciduous teeth. They actually start developing while the baby is in utero. So when moms are pregnant, the baby's teeth are already starting to develop. When the baby is born, they're born without teeth, we know that, and they start to erupt these baby teeth at a wide range of ages, anywhere from about 3 or 4 months, which is on the early end of things, all the way to 8 or 9 months, which is on the later end of things. Somewhere in that wide range is when you'll start seeing the baby have their baby teeth erupt. A lot of parents get concerned if their babies aren't developing their teeth in a timely fashion and they don't know what the range is, but most typically it's a pretty wide range. Once the teeth start developing or start erupting, you're going to want to start taking care of those teeth because those teeth have to last your child until they're at a minimum of 5 or 6 years old and quite a bit thereafter. So it's a fallacy to think that, well, these are the baby teeth, they're going to come out, there's no big deal, we really don't have to do it. And there's a couple of reasons that's wrong. One of them is we just want to maintain oral health. At all times, a dentist's concern and what they want to share with you is how to maintain good oral health because, as we've talked about before on previous videos, your oral health works really, it intertwines with your general health. So you want to make sure you stay healthy. The other thing is you want to teach your child, even from infancy on, what it's like to be taking care of your teeth, what we do to take care of our teeth, how we develop good habits in caring for our teeth. So let's talk about that for a little bit. Your baby's teeth are starting to come in. What can you do? When they're first starting to get their teeth and they're still infants, all you're going to want to do is clean the teeth with a washcloth, a wash rag that's wet with some warm water. You don't put toothpaste on it, you don't put soap on it, you don't put anything on it, just some warm water, and gently massage the new teeth that have been coming in. And massage their gums a little bit too, it feels really good to the baby. This will get the baby to understand that mom and or dad occasionally come and put their finger in their mouth and seem to do something in my mouth. They're going to understand that this is going to be a routine as you do it on a regular basis. As they get older, they're more toward the toddler age, you can now get them a baby toothbrush, a very, very ultra soft toothbrush that you can use to brush their teeth. And of course, you will be the one that's doing that with them. They can help, but you are the one that really needs to get in there and make sure that all of their teeth are clean. By the time they're about 2 years old, they'll have all of their baby teeth, and there are 20 of them. So they'll have 10 teeth on the top and 10 teeth on the bottom. And any young child that's come to my office and had me check their mouth knows that we count them out loud, 1 through 10, 1 through 10. So they get one of their first math lessons in our office in counting the teeth. That brings me to another point. When do you bring your child to check their baby teeth to the dentist? You should start, in my opinion, bringing your child to the dentist as soon as your child is almost born. Whenever your child is able to stay in his or her little car seat or his little carrying seat, you should bring them to the dentist with you. So when you go for your twice annual checkup, you should bring your baby and have them sit there and watch as mom or dad get their teeth checked and cleaned and mom and dad are having a great time. And they'll learn at a very early age that it's not a big deal to go to the dentist. As a matter of fact, it might be fun. As soon as they're a little bit older, typically around the time they're 2 years old, sometimes earlier, sometimes a little later, we can have the baby or the infant or toddler sit in mom or dad's lap and the dentist can look in their mouth and just basically count teeth. At the same time, they're assuring the mom or dad that their teeth look healthy and everything looks really good. What are some of the problems that baby teeth might have? One of the biggest problems is something that you would think this would be not a bad thing for the baby because you're doing it because you help and love the baby, and that is putting your baby to bed with a bottle. And if the bottle has juice in it or formula or milk in it, you're not doing your baby any favors. If your baby needs to be soothed to go to sleep with a bottle, that's fine. Just put water in it. Don't put juice with sugar in it or formula, because what happens once the baby falls asleep, and if the bottle nipple is still in the baby's mouth, that liquid is still going to pool in the mouth and just sit against those teeth, those nice new little baby teeth, and cause decay. And one of the worst things that a dentist can see in a young child is what we call baby bottle caries. It's just a fancy word for a mouthful of decay because the baby was consistently put to bed with a bottle that had juice in it or formula or milk. So if your baby must be soothed with a bottle, that's fine. Just make sure it's with water. So brushing their teeth at an early age, or caring for their teeth at an early age, brushing their teeth when they're more toward toddlers. Not putting them to bed with any sugary substance, only putting them to bed with a bottle that has water if you need to do that. And making them get used to the idea of going to the dentist. Those are 3 really good things to do for a child, a baby, toddler, and a child in caring for their primary teeth, their deciduous teeth. As the teeth start falling out, and typically that's a wide range also, they'll probably lose their first lower front teeth anywhere from the age of 5 years old to 8 years old. And again, parents can always feel free to call their dentist to ask if everything is going okay, because they sometimes get worried if the teeth are taking a long time in coming out. But monitor that. By that time, your child should in fact be with a dentist so that the dentist can monitor how the teeth are erupting and how the primary teeth are coming out. One last thing that I'd like to touch on are pacifiers and thumb sucking. It's a very common thing for children to need to be soothed when they're anxious, when they're sleepy, and we often use pacifiers that we will give to our babies, or the babies will have found their thumb. There's really nothing wrong with that in the big picture. It's a very soothing, it's a very comforting thing, and many babies need to do that. The issue becomes one where as they get older, if they haven't stopped that habit, it can create problems with the bite. It can create what we would most commonly refer to as an open bite. So using a pacifier or having your child suck his or her thumb is fine, but it would be a very good idea to try to start to wean the baby from using those thumbs or pacifiers after the age of 2, somewhere between 2 and 3. Those seem to be the easiest ages to help them to wean that habit. Sometimes if you wait past that, it becomes more difficult. It really becomes a need for them. So it's really a good idea to try to get them to stop that habit so that their development of their bite has a chance to be more normal. So those are some of the things that I wanted to talk to you about with baby teeth, with deciduous teeth. They're just as important in so many ways as our permanent teeth, and establishing the good habits for caring for their teeth as toddlers and young children is incredibly important. It'll really be the mainstay for how they will approach their own oral health as adults. So that's it for today. If you have any questions, you can always call our office, and you can always email me at info@parkridgedds.com. That's info@parkridgedds.com. I'd be happy to answer any of your questions regarding baby teeth or any other dental related topics that you might be interested in. So that's it, and remember, as always, we love making you smile.